All right, welcome back. A CDC panel has recommended a booster vaccine that targets new COVID variants. It comes as the virus is sending more patients to the hospital in North Texas. 394 people are hospitalized right now, about 150 more patients than this time last month. The majority have the XBB or XBB 1.5 strain. Here to talk more about the updated COVID-19 vaccines and the new variant is Dr. Philip Huang with the Dallas County Health Department. Dr. Huang, thank you so much for joining us today.
Thank you.
Yeah, so there have been so many variants since we first learned of COVID, and it could be challenging to keep up with what to expect if you're infected. But what can you tell us so far about this new variant and also the other variants? Are the symptoms similar, or are we seeing something different with these?
Yeah, the symptoms of the XBB 1.5 are similar. There's also the EG5 that's out there, but they all seem to have similar symptoms, not as severe illness. But some, again, I think probably everyone's anecdotally hearing about people who are testing positive. So it's a lot of transmission that's going out there.
And we know that these COVID boosters are coming out this potentially soon. Who is eligible for those? And what about kids too? What have you guys heard at Dallas County Human and Health Services?
Sure. So CDC came out with recommendations for the vaccine for everyone 6 months and older. So that the benefit is, there for everyone to get that. Again, as I was saying, there's still a lot of transmission going on out there. And as you were reporting, we're seeing increases in hospitalizations, but they're not at the same level that we've certainly seen in the past, but definitely seeing increases in number of cases and some of those increases in the hospitalizations also.
Yeah, and Dr. Huang, you were so vocal during COVID-19 in its early stages and throughout those times when we were trying to get Dallas County vaccinated. When can people get the shot do you expect for these new variants, the booster that's looking to be approved here by the CDC?
Yeah, we're hearing that it's probably some of the pharmacies may get it by the end of the week or early next week. The health department, we're still waiting to hear from the state health department, and have heard we're not going to be able to get them ordered until sometime next week. But we're anxiously awaiting them. We really want to get them out, and everyone should take advantage of these new vaccines.
And Dr. Huang, we want to talk about just those hospitalizations, anecdotally, the infections that we're hearing about. You were such a measured person when it came down to the pandemic. What is the advice that you would give anyone right now? There's no reason to panic, we're hearing from health experts, because obviously, as you're reporting, the symptoms aren't severe like we first saw. What would be your take on this if you were just talking to a family member or someone that you know personally?
Well, certainly, anyone who's at high risk for severe illness, older persons, immunocompromised persons, should do things that can slow down transmission. I've always said it's never a bad idea to wear a mask, certainly if you're in a crowded indoor setting or, places with poor ventilation. It never hurts to do that. But to do all the other things that we've been recommending throughout, if you're sick, stay home. Wash your hands, but again, try to keep that distance if you can, and in particular, if you are at high risk of severe illness.
Okay, that's really good information there from Dr. Phil Huang with the Dallas County Health and Human Services Department. Thank you so much again for joining us today.
Sure, thank you. And the bottom line is also get the vaccine as soon as it's available.